Excellent talk. And our last talk is by Dr.
There
Anupam.
is
She'll be
one
talking on
important
aberrant
thing I would like
innervation
to
in
tell
third
you,
nerve palsy and management.
that in any case
Dr.
of
Anupam is
cataract,
working as
if you find some white spots
additional
over the
professor at Rishikesh
anti-capsule,
AIMS.
calcified
And
spots,
she has been
these
doing a
are
lot of
known
good
as
work in
BA
strabismus
spots,
and
basic
pediatric ophthalmology.
spots.
Thank you
In
very much,
those
sir.
cases, you will see that the posterior capsule is absorbed.
I will be talking
Dr.
about
Anupam,
the
please.
management of third nerve palsy with aberrant regeneration.
Okay.
Slides are not moving. Yes, ma'am.
Please.
Aberrant regeneration of third nerve is otherwise known as oculomotor synkinesis. It is an uncommon but well-described phenomenon. It can occur in both congenital and acquired cases. It can occur primarily as well without any preceding nerve palsy. And most common etiology is trauma, tumor, aneurysm, hemorrhage, or congenital or other disorders. Pathophysiology, most of us know that aberrant innervation phenomenon throughout is the peripheral misdirection of the regenerating axons. It can result from persistent partial oculomotor recovery, and the nerve fibers grow to supply muscles other than their original terminal muscles, leading to co-contraction of these muscles. There could be two forms: primary oculomotor synkinesis, typically secondary to slow-growing intracavernous lesions, and without any preceding signs of third nerve palsy, and secondary mostly because of trauma, tumor, or surgery. So, clinical phenomenon of aberrant innervation can be manifest in the lid gaze or pupil gaze synkinesis. Eyelid retracts, as we here it is shown in the figure, that eyelid retracts when patient adducts his or her eyes. This is known as inverse Duane sign, or eyelid retracts when patient looks down, that is pseudo von Graefe sign. Pupil gaze synkinesis. There is a video. Pupil constricts on adduction or on down gaze or on convergence. So, classical treatment of third nerve palsy is ipsilateral recession resect of horizontal muscles followed by vertical transposition muscle, or PADEN if required, followed by ptosis surgery. But in 1980, O'Donnell and associates suggested a new approach by using contralateral resect procedure of horizontal muscle if there is synkinesis on adduction. So, the aberrant innervation regeneration can be we can take privilege of aberrant regeneration to manage ptosis and horizontal strabismus simultaneously in these kind of patients. And the rationale is by making the fixing eye isotropic in primary position post-operatively, the innervation of lateral rectus muscle increases, and so the contralateral MR gets more supply, and so is the LPS, which is has co-contraction with the MR. Advantages are simultaneous correction of both strabismus and ptosis in single sitting, and reduces patient discomfort, and complication of ptosis surgery can be avoided. But disadvantages are performing on the sound eye surgery, which may not be feasible and very difficult to convince some patients, and eyelid retraction and adduction may become more cosmetically displeasing post-operatively. This is a case of partially recovered right third nerve palsy having video I have shown is of this patient only, having pupil gaze synkinesis. Near vision was N36 preoperatively. We did horizontal muscle surgery on the other eye, and near vision improved, and the patient has some residual exo and plan for a second setting surgery. This is a case of post-traumatic left-sided partially recovered third nerve palsy having inverse Duane sign. In this case, we operated bilateral LR recession and contralateral MR resection, and we can see that ptosis is taken care of. So, take-home message is contralateral surgery can be done in third nerve palsy with aberrant innervation. This allows simultaneous correction of both primary position, horizontal lesion, and ptosis in one step, and it can also improve near vision in cases of pupil gaze synkinesis. It avoids complication of ptosis surgeries. Thank you.
Thank you so much, Dr. Manupam. It was